Hey everybody, it's your girl Dr. Wright here with another video, and today we're going to be talking about eye care and eye makeup. And today we're going to be focusing on eyeliner. Now, besides lipstick, eyeliner is probably my favorite makeup item. So let's dig in about the ins and outs of eyeliner. So the video will be fairly short. We talked a lot about the glands inside the eye in the last video, which focused on mascara. So this time we're going to focus on how to apply the eyeliner safely and the things you want to try to avoid. So when it comes to eyeliner, you have a lot of different options. So you could have liquid liners, right, which look and I'm not going to talk about brands because you can get a bunch of different brands, but liquid liner, which comes with an applicator, something like this, or they come in like a brush form. And then you could also have pencil type liners that look similar to this. And then you can have ones that are a little bit thicker pencils and a little bit kind of more like gel form, something like that. And then you can have ones that are gel forms and come in little containers like this. So I like all of these and I own all of these, and it just depends on the kind of look that you're going for. And again, I am not a makeup artist, I am a doctor and optometrist, and so we're going to be focused more on eye health than brands of makeup. So any kind of eye makeup that you use, you have to make sure that it is going to be safe for the tissues around your eyes. What you want to try to avoid with eyeliner though, which is very important, is you want to avoid getting it on what they call the water line. So when they say water line, what they are talking about is right along the lash line here, right? And the reason why it's important to really avoid that, even though people think it looks very trendy and it makes your eyes kind of pop, the thing that's really important is that when you put too much liner or product along that lash line, then what happens is you can clog those meibomian glands that are in your lids. And those meibomian glands are very important because they produce oils that help keep your tears on your eyes for longer, right? And so when they can't do their job properly and secrete the right amount of oils, what happens is that your eyes get dry, they can get irritated, and you can have lots of ocular inflammation associated with dryness and irritation. Again, getting the products inside your eyes also is oftentimes not safe because it can cause a lot of infection, inflammation, irritation to the ocular surface. So we all love to wear makeup, but you have to be safe when you are doing so. So when you are applying your eyeliner, you want to make sure that you are applying it to the lid margin, but not where the glands are and your lashes come out. And the same for the bottom. You want to apply it right below that lid margin, right along the line underneath the lid margin, so not directly onto the lid margin, so not on that water line. Okay, so that's very important. Also, whatever eye makeup that you decide to use when it comes to eyeliner, whether it's a liquid form of eyeliner, it's the pencil form or the gel form, what you want to make sure and be safe about is that it is going to be ophthalmic safe and it is not going to have ingredients in it that can cause ocular irritation. So it's very important oftentimes to check the makeup that you use and make sure that it is hypoallergenic. And so that decreases the risk of you having some sort of allergic reaction. Even if the risk of allergic reaction is decreased, you can still get ocular irritation by getting the product inside the eye. So it's very important to apply the product safely. So I will just show you how I apply my eyeliner, and I'm going to just use a brush and my gel liner because I prefer gel liner because I like the matte appearance of the line with the gel liner. So I'll just show you what I do. So I have my handy dandy brush here, and I'm going to get some of the gel liner. And again, like I said, not a makeup artist, optometrist, but also makeup enthusiast. So all right, And so I like to apply it to the top top lid, excuse me. I'm not wearing liner today, so I'll be applying this. And you'll see I get a nice matte line across the top of my lid, and we'll do the other side as well. And you can see I get like a nice matte line, and I like that. When you use a liquid liner, oftentimes the liquid liner is a little bit shiny, looks a little more wet. So it's kind of all a matter of preference, but you just want to make sure that you're being safe. You can see that I am not going onto the actual lid margin. I'm doing it right above the lash margin where the meibomian glands are housed, right? And then I'll also show you underneath. I usually do not wear eyeliner underneath on my bottom lid. That's just my preference, but I will show you how to avoid getting it on that water line. You don't want to do that because you don't want to clog those glands. You want to make sure that you get it right below that, so it will give the illusion, right, that you are getting it on that water line, but you're really not. So you can see that I got it right underneath, but not on that line, because I don't want to clog those glands. And so that's how I would do it. In addition, you want to make sure that, and I guess we'll even out both sides, right? Just so I'm not looking completely crazy. And again, just gonna get it right underneath that water line, not on that water line. Now, I'm using that term waterline. That is not what it's actually called. That's your lid margin. I'm using that just because that's what a lot of people call it when they are putting on their makeup, right? And so, so you can see it's there, right? And then above. And that's kind of my preference, is to only usually do it above, but I was just demonstrating that you can put it underneath, right? So in addition, the other things that you want to make sure is, you saw that I used a brush to put on my gel liner, and I apply it generally with the brush. It's a liner brush, and the major things to make sure that you're keeping all your brushes clean, because you want to practice great hygiene when it comes to your eye makeup. So that includes cleaning your lids and lashes very well after you've been wearing your makeup, and when you're washing your face in the mornings, make sure that you're cleaning your lashes and getting all debris and stuff off of your lashes. You want to make sure that you're decreasing the amount of bacterial growth on your makeup brushes. That's very important. So you want to make sure that you're cleaning those things in order to avoid causing bacterial growth inside your makeup, which can then transfer onto your lids, your lashes, and then cause ocular infections, inflammation, and irritation, right? So always practice great hygiene when it comes to makeup use. Make sure that you're replacing your makeup every 2 to 3 months. That's very important. And thank you for watching. Please let me know if there's any other things that you would like for me to cover regarding eye makeup, or any other subject regarding eye health. That's why I'm here, right? Your optometrist extraordinary. And before I go, I want to give a shout out to, I believe it's called My Pride Apparel. This is not sponsored. I just saw the sweatshirt and really liked it, so I will show you what my sweatshirt says. It says, "Yes, it's my real hair," and I thought that the sweatshirt was super cool and super dope, and I get a lot of questions about my locks, and so I just liked the shirt and thought it was cool. So thank you for watching, and shout out thank you to My Pride Apparel for making the shirt so that I could purchase the shirt. It's super cool, and like I said, it's not sponsored, it's just a sweatshirt that I like the saying on. So just wanted to show you guys and give them a little shout out. Thank you for watching. Bye.